everybody. So this week's discussion board is about a mom and a daughter coming in to talk about HPV and the vaccination and the safety and efficacy of that vaccine. So after a thorough examination and history, I would talk to this mom and daughter about what HPV is, just to kind of give them a better grasp of understanding of how the vaccine works, how the virus works, and why the CDC is recommending it. I would inform them that 1 in 4 people are infected with some form of HPV in the United States, and that 80% of people will get an HPV infection in their lifetime. So it's pretty widespread, pretty common. And I'd let them know that there's about 150 types of the virus, different strains, and that the good news is that 9 out of 10 times the HPV will resolve on its own within 2 years if you have a healthy immune system. However, I think it's also important to make sure you let them know that there are some types of HPV that can last longer, and those HPVs can cause genital warts or cancer, and that's kind of where the vaccination comes into play. So it's important to let them know that the vaccination can prevent most of these HPV-associated cancers. Not all of them, but most of them, and these are the ones that are going to do the most damage. The CDC recommends that all girls and boys who are 11 or 12 years old should get the recommended series of HPV vaccine, and the vaccination series can be started even at age 9 years old. However, there boys and girls who did not get the vaccine when they were younger, like her daughter, can still be given the vaccine, and we would let her know that it's recommended at this age because in order for the vaccine series to be effective, it's supposed to be given before exposure to HPV. And then I would also let them know that there's no reason to wait to vaccinate until teens, reach puberty or start having sex. There's no contraindication to giving it early. And we want to give it as early as possible so that we are avoiding that exposure. Whether you think your child's going to be sexually active or not, that's not something that you really want to bank a potential of cancer on. So to answer her questions about efficacy, I would tell them that, evidence has showed HPV vaccines are giving nearly 100% protection against cervical precancers and genital warts. And since we've started the HPV vaccine, there's actually been a 64% reduction in vaccine type HPV infections among teen girls here in the United States, and fewer teens are also getting genital warts, and cervical precancers are decreasing as well. And I also read that in other countries where they have wider protection against HPV type vaccines, they're even seeing more of a decline in those rates as well. So then, to address her questions about safety, I would tell them that even though there is a lot of misinformation out there about vaccines, the United States actually currently has the safest, most effective vaccine supply in history. I would reassure them that years and years of testing are required by law to ensure the safety of vaccines before they even put them on the market for use. I would also let them know that no serious safety concerns were ever identified in any of those clinical trials prior to the medication being released for use. And, they should also be told that the FDA only licenses a vaccine if it's safe, effective, and, it's beneficial for a lot of the public, and the benefits outweigh the risks. Also, the CDC and FDA are always continuing to monitor vaccines, including the HPV vaccines, to make sure they continue to be safe for the public. And maybe even mention in there that, we have a reporting system, and so new things are continually reported if there would ever become an issue, or we would start seeing things in the clinic setting, that there is that reporting system. And then lastly, I think it's also necessary to do some anticipatory guidance for the daughter, with or without her mom in the room, about safe sex practices, the risk of other STIs, and how to prevent those, such as condom use, etc., because the HPV vaccine does not protect from other STIs, and it even doesn't protect from all types of HPV. So that would be important to include as well. Thank you for listening.